Well, pesticides are really important for the farmers. The farmers, they can produce more by avoiding the damage due to pest and diseases by using pesticides. The pesticides are meant for killing pests and diseases. About 15 to 20% of the crop are damaged every year due to pest and diseases. What we have to do is use the pesticides so that we can produce more food. As per the Food Security Act, the government is bound to provide sufficient food to every individual of the country. The pesticides, however, are toxic in nature as they have to kill the pest and diseases. If these pesticides come in contact with the human being, the poisoning may occur. In case of a pesticide poisoning case, the first thing we have to give is first aid. We have to bring the patient out of the scene. After bringing out of the scene, what you have to do is you have to remove the clothes which have been drenched by pesticides and keep it inside a container. The third thing you have to do is the resuscitation. Resuscitation means you have to resuscitate the patient and through rule A, B, C. A means you have to see whether the airway is patent, B is whether there is breathing is there or not, and C is the circulation is perfect or not. For that you have to give the high flow oxygen if available, intubate the patient. If there is breathing has been stopped, then what you do is mouth to mouth respiration you can do, but you have to protect yourself that you should not be poisoned. Next one, the intravenous infusion of the normal saline or any other fluid you have to give so that all organs get proper oxygenation. Then you have to, if the patient is very serious, then you have to send it to the ICU. Then you do the clinical examination, see the pulse rate, see the respiration rate, see the blood pressure, see the condition of the pupil, whether it is dilated or constricted, see whether the patient is sweating, all these, and also auscultate to the lungs, what is the condition of the lungs. All these things you have to do during these first symptoms. If there is a seizure or convulsion, you have to give the anticonvulsant drugs like diazepam. Suppose there is a swallowing of the pesticides, then never do the gastric lavage. Look to the label, whether label say to do so. Gastric lavage is not going to do any benefit to it. When you bring the patient, first you put him on the left lateral position with the neck little bent, so that you can avoid the aspiration, the gastric emptying is delayed, and there is no blockage of the breathing. And if there is a paraquat poisoning, never give oxygen. This is contraindicated. The first thing precaution is you yourself. As a medical doctor, you have to take all precautions so that you are not poisoned. Not only you, all health care givers have to take all precautions like using of protective clothing, gloves, masks, etc., so that you are not poisoned. The second very important thing is you treat the patient, not the poison. Third one is, while taking the history, you have to say, you have to take the occupational and environmental history of the patient. Fourth one is, many of the symptoms in pesticide poisoning cases are similar to other common diseases. You have to have a differential diagnosis for that. And basic thing is, you must give the symptomatic treatment to the patient and resuscitate. Well, my closing remark for the healthcare professional is that whenever they get a patient, they should not presume that all are pesticide poisoning cases. They have to have a differential diagnosis, number 1. Number 2, if no antidote is given, better to, as I have told you, treat the patient, not the poison. That means the symptomatic treatment has to be given along with the first aid. I am Dr. Debabrata Kanongo. I retired as Additional Director General Health Services from Ministry of Health and Family Welfare, Government of India. I am basically a human health risk assessment specialist, and all my years I have spent on management of pesticide poisoning cases.